Welcome back to Aging in Arizona. I'm your host, Presley Reeder, here with my co-host, Mark Young. And if you're just joining us, our guests today are Misha Dick and Serena Schluter. Misha is the Vice President, and Serena is the Director of Operations at Health Signal Partners. Health Signal Partners is a wonderful service for Medicare patients. Medicare has a code. We're going to talk more about how that all works, but you can find out more at their website as well, healthsignalpartners.com. Again, that's healthsignalpartners.com. Mark, during the break, you wanted to follow up on something.
Well, I just wanted a little bit of clarification. Serena, I'll direct this towards you. I love the statement, the head-to-toe, get to know. You guys use a lot of technology to make sure this is up and going, following up with the clients, the patients that are out there. So I'm trying to see if I've picked up. Is there a face-to-face consultation in developing the care plan that goes along, or is this strictly done by the phone?
Great question, Mark, and thanks for clarifying. Yes, it is a face-to-face visit with the client.
I thought so.
And we can perform this in multiple places of service. We can go inside their providers' offices, assisted living facilities. We've most recently gone into senior centers and into the patient's home.
And by doing that in the physician's office, you're getting buy-in from the physician of exactly what needs to be entailed inside this plan.
Absolutely. And we're an extension of that primary care physician. At no means do we take over care. We actually partner with the primary care physician.
Yeah. Good clarification question, Mark. Misha, back over to you for, again, this summary of the gap. You were going through the three steps, which I think are really key in the process, but I want to make sure our listeners understand the gap that Health Signal Partners is filling from your perspective in the marketplace.
I think that's a great point. So the gap, the way we're seeing it, is really between the family, the friends, the social support network of the individual and the clinical staff that also is part of the support network. We kind of sit in the middle of that, if you want to think about it that way. We connect. So for one, we really do a comprehensive assessment of the individual. And like we said earlier, it's not just a clinical assessment. It goes way beyond a clinical assessment. If you really do, so this comes back to the history question. Why did you do this? How did you get into this? And if you look at why are individuals not successful in it, I'll call it adhering to care plans. I think that's a bad word, by the way. It's really in being able to better manage their own health, right? That's what we're after, is how can we support individuals managing their own health? How can we prevent? Ultimately, our objective is increase quality of life, prevent acute care episodes, right? That's big. If an acute care episode happens, it's very stressful on the individual, it's stressful in the family, it's bad for everybody, and it's expensive. Let's face it, that's another reality. So when you look at it from that perspective, it is ultimately oftentimes the social network of the individual that really has to get engaged and support this. We're that middle layer to accelerate that, to take workload off of the individuals that are supporting that particular person. And again, I go back to what Mark said earlier, how much does it time? Just if you think about social or community services is a better way to say it. Community services are a very, very local thing, right? At sometimes not even at the zip code level, it's at the street level. Well, how much time does it take a family to research Meals on Wheels from my address? Who can actually deliver them? Who cannot? Well, this is what we do. We have a catalog of these services available at our fingertips. So instead of the family having to spend the research to do that, we do that for them. Spend quality time with your loved ones. Let us take care of knowing where to go for these kinds of services. So it comes back to this three-step process, and I know I'm going a long way around to answer your question, but it comes back to this three-step process. Step one, get to know the individual in a much broader sense. From a clinical perspective, understanding who the caregivers are on the clinical side, understanding who the caregivers are on the personal side, right? Second step, let's develop a care plan we can all agree to. And it's really care plan, again, is almost a little too clinical. It's a wellness plan. It can be things like, imagine you walk out of your doctor's office and you get the instruction of you should exercise a little bit more. Well, what does that mean exactly? Let's have that dialogue. Maybe exercising for you is walking around the block once a day while it's not so hot. That can be a care plan item, right? So we develop that together. And then step three, the way we look at it is we keep an eye on things. We are there as a support structure to make preventative appointment visits, We have a piece of technology I'm sure we'll talk about later that gives us some insight into, is the individual successful with this plan we've all come up with or not? And here's really our job now. Here's the core, the crux, the center of it all. Our job is to help you be successful. So if there is a barrier that needs to be removed for your success, our job is to remove that barrier. So it may be things as, an example would be transportation. Making an appointment to a cardiologist and making sure the individual has a way to get there. Those are two non-trivial steps for a lot of individuals, and that's where we step in.
But a reality.
An
A
absolute
lot of times
reality.
People assume, they make assumptions.
And you know, we spend a lot of time in hospitals too, and here's the one thing that I really over the years have realized. Our parents, many of them are, they're greatest generation folks, and they rightfully have a lot of pride. And just asking for the help can be a barrier to the help. So we provide mechanisms through the technology, through the service, where it's easy to ask for help. I don't have to make 10 phone calls to people that might turn me down, which are all a reminder of I can't drive by myself anymore. I shouldn't drive by myself anymore, but I still need to do this. So what happens in the real world is oftentimes even preventative appointments aren't scheduled and aren't taken advantage of because of these kinds of barriers. Well, let's remove those barriers. Let's take them out of the way, have a personal health coach. We always like to think about it think of this as your Medicare-provided concierge service. Use it, you've earned it.
Yeah, and let me jump in there because you say Medicare provided, and another barrier that we run into with almost every product or every service that we or every provider we talk to is cost.
Yes.
You're saying Medicare provided, so let me go to Serena and say, Serena, what does Misha mean when he says it's Medicare provided? Has Medicare, despite all of the knocks against Medicare and the government not identifying needs and all of that, has Medicare actually identified something here that's extremely helpful and they're willing to pay for it?
Absolutely. I think Medicare got it right this time. So in regards to the face-to-face, head-to-toe get-to-know, that is absolutely at no cost to the patient. So we spend 1 hour with the patient. Nowadays, it's pretty unheard of. Sometimes our PCPs don't have that much time, but we actually take the time to get to know the patient thoroughly through this head-to-toe get-to-know. Now, in regards to the chronic care management services, there is a co-insurance that is applied like for any other Medicare beneficiary. However, we have constituted the right to implement a hardship policy for those patients that qualify, and then we are able to waive that copay for them if they qualify for that hardship.
And if I remember correctly, it's a fairly nominal copay.
Correct. That is an $8 copay.
Yeah. So this is the barrier. This is another barrier that's been removed for you, in this case by Medicare, to really reduce, if not eliminate, in many cases, the cost of having these care management concierge services for your loved ones. And if you're out there, you know about this gap if you've had a loved one that's faced some of these chronic conditions. So you know that there is this gap and that you're going to need to reach out to Health Signal Partners. Again, healthsignalpartners.com for more information. Don't go away because we have a lot more to get into on how this service works and how it can benefit you and your loved ones.